Dr. Ajay Dudani, vitreoretinal surgeon practicing at Mumbai Retina Center, Santa Cruz, and Zen Eye Center at Thar. I've been in practice for the last 25 years, and I treat complex retinal conditions with retinal detachment surgeries, diabetic retinopathy, age-related macular degeneration, retinopathy of prematurity, and various other retinal conditions. We are living in very tough times of COVID-19 now, and with the lockdowns and the various masking and other cares. So our clinics are very ready for this pandemic with social distancing, masking, sneeze guards, profuse use of sanitizers. And this has shifted us all into the digital era where we are treating all patients digitally with telephonic conversations and consultations also. And my patients also having a lot of complaints of computer vision syndrome, which is due to excessive use of laptops and screens with a lot of webinars happening all the time, which is leading to an increase in dry eye symptoms, patients complaining of gritty feeling, tired eyes, strained eyes. So computer vision syndrome has become another pandemic along with COVID-19 with work from home situation. Many eye conditions, especially retinal conditions, should not be delayed in their treatment because of the lockdown. Since last 7 months, many of my patients have missed their appointments with me, especially for their intravitreal injections for retinal diseases like diabetic retinopathy, laser treatments, and injections for macular degeneration. So this delay can lead to permanent and irreversible vision loss in these patients. Unlike in cataract, where we can recover the lost vision by putting a new lens and doing a phacoemulsification surgery to remove the cataract. Even a dangerous condition like glaucoma, where the eye pressures are high, we need to closely follow up with your eye surgeon and get your eye pressures checked so you know that you're not damaging your optic nerve much more. India is having the second highest number of COVID-19 cases, as we are aware as of today. But we are soon heading to become the number one capital for diabetic retinopathy in the world. So, briefly, I want to tell you all about diabetes and eyes. And diabetes can make you blind. Diabetes is a irreversibly blinding condition, and it can affect the active age group, the age group between 45 to 55, where the person is working and earning for his family and himself and his very productive years. So, we need to screen every diabetic every 6 months to 1 yearly to see whether there's any bleeding in the retina, any leakage in the retina, and treat it with intravitreal injections and laser therapy. Controlling diabetes forms the backbone of treatment of these patients with diabetic retinopathy. And we here at Mumbai Retina Center are very well equipped with all the technologies, the lasers, the optical coherence tomography machines, and the injection therapies of new injections which are coming up to treat this scourge of blindness which we're going to see in these patients who suffer from diabetes. The second condition also which is increasing as our elderly population is increasing is age-related macular degeneration. And this condition leads to formation of new vessels under the retina which keep on bleeding, and they can lead to loss of vision, loss of center vision. And this loss of vision in these old age patients can lead to depression and various other psychological disorders. Increased incidence of falling with fractures and other morbid conditions. We can treat this condition with repeat intravitreal injections which we give in the eye in the outpatient department, and even improve the vision of these subset of patients and prevent the visual loss in these patients. So I think the message which I want to give finally is that this COVID-19 pandemic has had many effects in our life. It has turned the full world upside down. But in ophthalmology, I would request you all that please keep your appointments with your doctor, especially for your injections, for your eye pressure measurements, for your eye conditions, because eyes are very precious and once vision loss can never be recovered. Thank you very much for your kind hearing.